Hey guys, we are live on Facebook with Nathan Shah of the Roscoe Dental Practice. So, hey Nathan, how's it going?
Hi, Stephen. Pleasure to be here.
So, we're talking today about the biggest problems people have with their dental and health, correct?
Yeah, more specifically, the biggest problem people have when visiting the dentist.
Yes. So, what kind of problems do you see with people visiting the dentist?
Now, biggest problems that stops people visiting the dentist is obviously everybody is nervous to a certain degree visiting the dentist. Now,
Yeah.
this could be because they haven't visited the dentist for a long time and they're concerned about what the dentist might find, or they're concerned about the actual treatment. And I find that if patients don't know exactly what needs to be done and how it's going to be done, they can be a bit concerned. It's the fear of the unknown. The other things that my patients would tell me often is that we are afraid that our dentist will give out to us because we haven't visited the dentist in such a long time. So these are the things that come to mind, Stephen, about patients not wanting or stopping them from visiting the dentist and taking that leap of faith, making that phone call and making that appointment.
Yeah. So dental health is like so important, right? It's obviously you're a dentist, but I'm an osteopath, and we have a health clinic, and the number of people that come in that I think that have health issues that could be linked back to issues that they've originally had with their teeth. Um, so I know a big one is kind of like, and it's quite topical, dental amalgam.
Yes.
What's your views on dental amalgam?
Dental amalgam is commonly known as the silver filling, and it is quite a commonly used dental filling, and it used to be the gold standard for years and years. And it is used still widely within dentistry around the world. To the best of my knowledge, it is safe to use. The adverse effects from it are very, very minimal. Uh, However, over the next few years, it might be phased out for environmental reasons. So we are looking for alternatives. But to be honest, in the white fillings or the composite fillings that are used very commonly nowadays are becoming the gold standard. And most patients prefer to go for a white filling where possible. But amalgam filling has been used very, very safely for a lot of years, and some of them have been there. Ones that I see in my clinic that have been there for 30, 40 years, and they've been performing well. In general, we don't tend to replace fillings, white or silver, composite or amalgam, unless there is a clinical indication for it, and that would be my personal view on it.
Yeah, no, it's fantastic. If you're joining us on Facebook, we've actually put a poll together of the common problems that people have with visiting the dentist or visiting other healthcare practitioners. So it would be really cool to hear back from you. So just comment in the box below. And hopefully we'll hear back from a few people on Facebook with some of the health concerns that they might have, that either with their teeth or with their backs or anything that they have that we can potentially help them with live on Facebook. So, Nathan, so why do you think people are scared coming to see you if you're a dentist? Now, you look like a pretty friendly bloke, but why do people get scared?
Um, Now, this is mainly my personal experience and my personal opinion, but a number of things. Again, as I mentioned earlier, fear of the unknown, not knowing exactly what is going on. It is a very personal relationship, I find, and not many professions would get right up into your personal space to do their work. So that is quite off-putting to some patients, but at the same time, if we don't get that close to our patients, we won't be able to do our job properly. The other thing is previous experiences, possibly. Back in the day, someone might have had uh, a negative experience for a reason or another, and that tends to stay with patients on later on in life, and they always remember that first negative experience. And unfortunately, we as humans tend to forget the positive experiences that come to that, or it takes years to overcome that fear and negativity associated with visiting the dentist.
Yeah, it's interesting because we were talking earlier on about the last time I visited a dentist, and the one thing that stands out with me is not the fact that I need to go to see a dentist, but there's always this memory of this dentist coming at me with this kind of big needle and trying to get up underneath my jaw. But you were saying that dentistry's changed quite a bit recently or over the years. So how does that differ now compared to dentistry like in days gone by when I was a young nipper?
Stephen, one of the things that, in my opinion, has changed is communication. I think communication between different practitioners and their patients has differed significantly over the years. So nowadays, we try to put patients at ease by explaining what we are actually proposing on doing. And yes, for example, the needle, we tend, especially for our younger patients, we don't tend to call it the needle anymore. We call it different things to make it a little bit easier, like the sleepy water, sleepy jelly. And those anesthetics that we use, they are quite more effective, especially with the use of topical anesthetics. We try to make it as comfortable for patients as possible. So a lot has changed. It's not about just getting that treatment done. It is an experience that we try to make our patients go through from the moment they walk into the practice, put them at ease until the moment that they are ready to leave our practice.
Yeah, that's really cool. I love that the whole health experience thing's been a massive part of what we've tried to kind of embed in the culture of the clinic as we've been like growing and developing the clinic over the 10 years. But like recently, since we moved online and we've gone virtual with our telehealth services, it's been really exciting actually getting that whole like experience right for the client coming into the business. So I know you guys have got telehealth as well. So how does telehealth work for you as dentists?
Now, obviously, with the way things are around us at the moment, we had to get some support to our patients. At the moment, we are trying to get our virtual health or telehealth or teledentistry off the ground. We do try and help our patients using basically the phone, for example. So we tend to help our patients in whatever way we can, give them advice, even answer some questions that they might have about their dental health over the phone to the best of our abilities. Obviously, Stephen, as you can imagine, with dentistry and a lot of health care out there, there comes a point that tele-dentistry or telehealth won't do it, and we have to physically see the patient. And if after doing that virtual consultation with the patient, we felt that yes, that patient needs to be seen physically by a dentist or by us, we try our best to accommodate them or at least guide them in the right direction. So it is a great thing. Technology is fantastic these days. It brings people closer and it allows us to still provide support to our patients whenever we can, especially in challenging times like this.
Yeah, no, it's tough, isn't it? It's like what would you do if you're at home and you had a toothache right now? What would generally people's choices be?
Obviously, over-the-counter analgesics would be one. It depends on what is causing that discomfort, Stephen. For example, if it is an actual toothache, over-the-counter analgesics, but sometimes they do need to maybe undergo a course of antibiotics or sometimes the actual dental treatment to be able to address that pain. But a number of other reasons could cause dental issues or dental discomfort, such as gum problems, an ulcer in the mouth, So it depends on what is causing it. And we try our best to make an assessment of what is the root cause of that problem and try to guide the patients in the right direction. But at the same time, sometimes you do need to actually see the patient to give the correct diagnosis and be able to provide the treatment that is appropriate for that situation.
You know, the more I listen to you, the more I think you should have been an osteopath, or maybe you were an osteopath in a previous life, Naysam, because you like everything you're saying is basically how osteopathy for me is like the foundations of it, about finding the root cause, getting to the underlying health issues that are causing the issues. Would you say there's general health issues that can affect people's teeth, and what could they be looking out for to look for those early warning signs?
No, that's a tricky question to answer. Obviously, our whole body is interconnected and the mouth is not a separate entity. So our general health does tend to affect our dental health and vice versa. Just from a very, very straightforward point, if, for example, a patient who is diabetic, as an example, and if they have a toothache or an infection, that could adversely affect their diabetes. And if they are not able to, for example, very simply, eat their meals at regular times comfortably, that could affect their diabetic control. So that's just a very general example of how your dental health can affect your general health and vice versa.
Yeah, no, it's really interesting. There's quite a few people watching us online, Naysam. So if there's anyone there that's got any questions about dental health, then this is your man sitting right next to me right now. But Naysam, what made you become a dentist? Why did you choose dentistry as a career?
Stephen, I've always thought about this. I've, believe it or not, before I decided to become a dentist many, many years ago, I wanted to become an engineer. I always liked working with my hands. I always say that dentistry is somewhere between science and art. And in dentistry, you do get that feeling. Basically, obviously, there a lot of science goes behind how things work and all of that. But at the same time, for example, if you're building up a tooth that has been broken for a while and all of that, it's like sculpting. It is. So I enjoy that aspect of it. And the main thing was that it gave me the opportunity to be able to help people in a very, very personal manner and be able to provide basically a service that is needed, much needed in our communities.
Yeah, it's I mean, you said something else earlier on that really resonated with me about how personal the services that you provide as well. So that kind of really stuck with me when you mentioned it, because you really are it's quite an intimate profession, isn't it? You're inside someone's mouth dealing with their health problems. So do you mind that side of things? What if people have got bad breath? You must get asked that a lot. What if your patient's got very small breath? How does that work out?
Stephen, it's part of the job, and but to be honest, we don't focus on those things. If, for example, a patient presents with bad breath, we have to try and figure out the root of the problem, because it could well be that a dental issue or a gum issue or an infection in the mouth that is causing that problem. But at the same time, once we eliminate dental factors, it could be something further down from the food pipe and further down. So again, it's like investigative work. You have to fix the problems at hand and then see what else could be, and if that guide the patient in the right direction. So we tend not to focus on the problems, and a lot of patients are quite apprehensive about visiting the dentist because they feel or they fear being judged by the dentist. That's actually not the case, because when a patient presents to the clinic, we don't judge by how they look or how long it's been since they've been to the dentist. We are there to basically see what are the patient's concerns and at the same time be able to communicate what the issues are and formulate a plan to addressing those issues. So we normally don't tend to focus on the problems that are present, but we try to focus on how to find solutions for them. And it is a teamwork, believe it or not, Stephen. We try to basically involve our patients as much as possible in their oral health, because at the end of the day, it is their mouth and it is their dental health.
Yes, it's such an important. I mean, we see that a lot of the time with people with their like backs, for example. I know it's not as intimate as someone's mouth, but it's I think a lot of the time it's trying to educate the patient on the responsibility that they have to take to be able to maintain the problem once you've helped them get it to a point where it's manageable. I think I really personally love that aspect of the job, because it's very satisfying knowing that you're putting people back on the right track with what it is that you're doing, whatever your trade is, whether it's like using injections or maxillofacial surgery or whatever it might be. It's like so rewarding to be able to help people get back on track. You must find that a lot with your job as well, right?
Absolutely, absolutely. That is like once we finish from a course of treatment plan, it might be short or it might be very long. But when we hear our patients say, I can smile again, and I am confident enough to smile again, that really makes our day. That's really what it's all about.
Yeah. Now, you specialize in smile restoration, don't you, as part of your, when I was talking to you earlier and talking to Saha, we were talking about different things that you guys specialize in, and that I found that quite interesting. So what is it about a smile that's so important? Why do people value their smile so much? I know why I value my smile, but why do other people value their smiles?
I think a smile is the first thing that people see. And Stephen, I am a general dentist and I focus on basically family dentistry. So we try to basically get the foundations right. Uh, uh, the first thing we look when a patient presents to our clinic is what their concerns are. And once we are able to figure out their concerns and we communicate with them, we spend a long time basically doing the initial consultation and trying to figure out what the patient actually wants at the end of their treatment plan. So getting the foundations right, it's really getting back to basics, addressing any issues, like if there are any cavities and stuff like that, sorting them out. If there are any gum issues, again, taking care of that to get all those foundations right. Do we do full smile restorations? To a certain degree, but at the same time, I like to know my limitations, and I know a lot of my colleagues might be much better than me in an area, and I would guide patients in their direction whenever necessary. So it is about the family dentistry and getting the foundations right.
That's very interesting. So for those people watching this and those people that watch it in the replay later, what would you say like your top 5 tips that you give to people that are absolute gold dust? What would you say are the key things to looking after your teeth the best possible way without flossing? So not flossing, because flossing is going to be your number 1, right? So if you couldn't tell people flossing, what are the other 5 things that you could tell them?
Believe it or not, no, Stephen, I think when we were discussing this, the whole purpose of this is to help people out there to basically take control of their oral health in those circumstances where you can't get to the dentist as readily. So I'm going to try and think of the 5 top tips. You took one of them out of me. That wasn't going to be my number 1, but it is in the top 5 certainly. So number 1 is snacking. I think snacking is very, very important. I always tell my patients, try to have your meals at set times, so you're not constantly grazing on food, because it has some deleterious effects on your overall dental health. So having set times for your meals, and that is particularly important for our younger patients. The other one is don't forget the routines. One of the things I always say to my patients is keep the habits up to date, basically, and don't make sure that because things are different and our routines are different, don't forget that you need to brush very well at night and in the morning. Don't skip those. Flossing comes after the brushing, obviously. It is very, very important. They do go hand in hand, and to the best of my knowledge, when the gaps are nice and tight in between your teeth, no toothbrush will get in there and do the job effectively. So the flossing would be my number 3. These are the 3 main ones that I can think of. If I can think of any other 2, I'll give those tips as well.
So can I come back to the first one? So you said eating regular meals is really important. Why exactly is that important for like dental health?
So just very, very briefly, every time we eat some any type of food, especially sugary foods that contain carbohydrates and contain sugar, chocolates and all of these things, the acidity of our mouths drops below a critical level. And it takes about an hour for the pH or the acidity of our mouth to go back to its normal levels. And in that hour, if we eat something else, the acidity drops again. So instead of allowing the saliva in our mouth, which is very, very effective at neutralizing that acid, to do its magic and work properly, we're not giving it a chance. We are constantly dropping the pH in our mouth, and that can have damaging effects on the enamel of our teeth. And that actually reminds me of an important thing. Don't always leave about an hour before you brush your teeth after any meal. A lot of patients tend to brush straight away after lunch or after breakfast. I normally tell patients, don't do that. You have to wait that hour before you actually brush your teeth.
My dentist tells that to me all the time, but they never really explain why that's the case. But why exactly is that the case that you have to wait after? And also, don't forget, I need to ask you about fruit juice as well, because that's something my dentist is always talking to me about. But why do you need to wait afterwards?
So as I said, if you brush straight away after eating, as I said, the acidity in our mouth drops, and that makes the enamel in our teeth a little bit weaker. And if you go and brush your teeth straight away, it could remove that weakened enamel layer, and over time that can have damaging effects, and it can cause what we basically call erosive damage or abrasive damage and all of that. So you have to wait that extra hour.
That's fantastic. Okay, my final question of the night. So I drink a lot of fruit juice, and my dentist is constantly saying that I shouldn't be doing that. It's a bad habit to drink so much, I know, because it's very, very sugary. But what's the long-term effect of that? Because I'm going to listen to you. So if you tell me I'm going to stop drinking fruit juice, but you've got to tell me, you've got to give me a good reason why I should stop drinking it.
Now, Stephen, you'll be happy to know that I won't tell you to stop drinking fruit juice.
Great. Lovely.
Everything in moderation. So you can still enjoy the fruit juice, but you shouldn't really be drinking it constantly because fruit juice, first of all, it is very sugary, but at the same time, it can be acidic. So for example, orange juice can be acidic. And if you're drinking bucket loads of that during the day, that can have erosive damage on your teeth or cause erosive damage to the enamel of your teeth. And over time, it doesn't happen overnight, but it can over time cause damage to your teeth. So you have to use things in moderation. Funnily enough that you mentioned fruit juice, that is the first thing that comes to mind. But in my opinion, sticky fruits, for example, one of the snacks that a lot of parents use is raisins, for example, because they are readily available.
They're very bad, aren't they?
They are. Because they are sticky. And say, for example, if you have a bar of chocolate that is not very, very sticky, over time, if you're eating a lot of it and you're not brushing your teeth, it can have damage. But the sticky dried fruits and stuff like that can stay on your teeth for a prolonged period of time, and that in itself can have damaging effects on your teeth, exposing you to higher risk of caries.
Yeah, no, it's fantastic. So we were talking earlier about kids that actually getting your kids to floss, but I guess that's probably a good thing to do if you've got kids that are eating raisins, is to make sure that they are flossing, right?
Absolutely. I have 2 kids myself, so it is quite important to be hands-on. We often trust our kids with their brushing a little bit too much. We have to be hands-on, and we have to actually, what I call it, supervise their brushing after a certain age. So we have to make sure that they're brushing their teeth, and every now and again, making sure that we are showing them the correct techniques. Flossing is as well important because even baby teeth have those gaps in between their teeth, and most brushes don't get in between those teeth, and that's where flossing becomes very, very important to clean those bits of food that get stuck in between your teeth.
Yeah, no, very, very interesting. That's a real lesson to learn, actually, and I'm really grateful for you to share that with me about the raisins, because it's certainly a snack that we give our kids a lot. We've got 2 kids as well, and it's certainly something that we've given them to a lot in the past. We don't give it to them so much at the moment, but certainly in the past it's been something we should have maybe thought about a little bit more. But yeah, it's really interesting. So Nathan, listen, it's been great talking to you tonight. If people have got particular questions that we haven't answered online now, how can they get in contact with you?
Now, obviously, they can comment below with their questions, and I'm sure they can be forwarded.
Yeah, we'll pass them over to you for sure.
Sorry?
We'll pass the questions over to you if they do comment below.
Yeah, and we will try our best to answer their questions, or they can drop us an email to info@rosscamdental.ie.
Yeah, fantastic. Great. Listen, it's been great talking to you. Please give my best to your family. And great, we've got this Facebook Live and Zoom collaboration to work as well. It's great.
Absolutely.
The world's coming together. It's awesome.
That's it.
Brilliant.
I hope people find those information useful. And sometimes I find that little tip that you take away from whatever meeting or whatever podcast might make the difference that you needed going forward.
Yeah. Yeah, no, it's fantastic. Listen, thank you so much for being part of this tonight. And we're going to try and maybe some kind of health feature where we go live and get a different health specialist on, especially while you're in lockdown, because it's so important you guys stay healthy while you're locked up inside your houses with the resources you have as well. But if you need to reach out to Nasan, then he's available. So just you're stuck at home as well, aren't you?
We are for the most part.
Even affects dentists. But yeah, it's great. Thank you so much for your time. It's been great talking to you. Cheers, Nasan.
Thanks for having me, Stephen.
See you later, mate. Bye-bye.
Take care, everyone. Bye.